I am Dr. Karn, an orthopedic surgeon, and I'm going to briefly demonstrate a product from Sun Medica called the OrthoWrap Hip Wrap. I do a lot of hip surgery, and I think this product is excellent. It holds a sterile dressing in place. The dressing itself is not sterile, but you can place the sterile dressing and hold it in place with the hip wrap. The hip wrap provides compression, support, and will hold the sterile dressing in place without tape. The hip wrap comes in two varieties. One is just the wrap, the other is a wrap plus a cool pack. So the hip wrap plus is the hip wrap itself and a cold powder pack wrap for cold therapy. The general principle is that this is applied in the operating room. It is reversible. The sizing and where the different parts of the wrap should line up are printed for right or for left. So for a right hip, you orient the writing where you can read it, meaning on the outside. So the placement is simple by laying it over the patient. The dressing would be in place. You just place it over the dressing with the thigh side, hip side, and waist lined up to their anatomic location. It's simple Velcro closures with a hook and with the loop. The opposite side is reinforced with some foam to make it stiffer so that it fits the contours of the waist. This is only in the larger sizes. So after positioning sterile dressing in place, then the wrap is slid underneath the patient's waist. I usually do it by folding it, putting my hand in it, then sliding it across. So you slide it underneath the patient's waist, kind of line it up. Then usually there's two people doing this. You just put the loop over the hook and it secures it around the waist. The thigh part is placed in a similar fashion. Notice I have a pillow between the knees. The pillow is not up between the thighs. This allows a space where it's easy to slide the hip wrap underneath the thigh, again it's a hook and loop closure, and that's all it takes. The hip wrap has a space or a pocket between the two layers of fabric. This is for placement of cold therapy, so the cool pack can be placed in this pocket over the incision. The cool pack conforms to the shape of the patient, provides even compression and the cold therapy. I personally use a Hemovac. I bring the container and I put it inside the pocket as well, which keeps it out of harm's way, especially during transfer of the patient. Cold pack in the freezer, reapplies very easily. Also, the composition of the hip wrap and other wrap products is a cotton lycra blend. There's no latex. There's no tape blisters because I don't use any tape on my post-operative dressings. This is supported by a study done a number of years ago as well. Therefore, I think that less chance of blisters, less drainage likely translates into truly fewer complications with the wound. Wound checks can be made very easily with a hip wrap. There's no tape on the dressing underneath the wrap. By just removing the closure, it can be pulled up so that the dressing can be changed, the wound inspected, and then reclosed. Again, no tape. It's important that the inner thigh not be over tightened. So this is a typical configuration with a bit of angle, looser and a bit more tight on the distal thigh to prevent chafing or the inner thigh being too tight.